My name is Jennifer Rush, and this is my service learning project for Nursing 400. For my service learning experience, I decided to help out volunteers at Beaumont Health. Beaumont Health volunteer services, specifically at Taylor, Trenton, and Wayne campuses. Volunteers in this area range from anywhere from high school students to retired workers who like to volunteer their time to help out at the hospitals or in different areas around the community. BOMA offers over 480 different volunteer opportunities throughout the whole system. These roles range from direct patient interaction to working with hospital operations and policies and procedures. One quote I really liked off their volunteer site was, "Beaumont volunteers are the eyes and ears of our community and an integral part of our team." Volunteers at these services really do help us as nurses and other healthcare workers during this tough time. Some of the volunteer opportunities that are available at Beaumont are clerical work, where you're assisting in some kind of office environment, community services, such as like running events that they may have in the community or giving out food to individuals. Emergency center, we have volunteers that work directly with our staff and patients to provide comfort care during some of these hard times. Same with hospice. We also have hospitality volunteers who work with greeting and directing patients throughout the hospital or to different services. We have individuals who help patients by bringing in their pets that are certified to give pet therapy to help with pain and other sources. We also have volunteers during COVID-19 who help families communicate with the patients that are in the hospital due to the no visitation restrictions that we had for a while. So volunteers are very helpful for that. And then we have a lot more opportunities available as well. For my service learning project, I educated some of the volunteers. So I did some research on emergency room equipment and the many different functions of it. I designed a PowerPoint presentation describing multiple ED equipment. Some of the things we did is detailed on equipment's functions, explained which patients may need which equipment, and then discuss changes in equipment due to different factors such as COVID, such as stripping a lot of the rooms of the equipment so that they weren't contaminated. I presented with a PowerPoint and a Zoom lunch and learn format. I completed 2 different Zoom presentations on different days to accommodate volunteer schedules so that more people could be involved. I had 15 Beaumont volunteers attend my presentation. After the conclusion of my presentation, I also opened the meeting up for any questions that the volunteers had. The questions ranged a lot during the different presentations. We explored topics such as the COVID-19 precautions that we took place during the pandemic in the ER to keep COVID positive and negative patients away from each other. We discussed community concerns and safety coming to the hospitals where people didn't feel comfortable coming in because of COVID. So we discussed some of the measures and things that we did to help bring people back into the ER when they needed services. Volunteers had questions regarding when they could come back face to face. Because of COVID, a lot of times they weren't able to do some of the jobs that they did before. And then additional questions we covered about included pathophysiology, such as the uses of ventilators and oxygen support in the ER. The objectives that I worked on during this project dealt a lot with public education. Public education on risk factors and identifying health problems was one of the objectives that I did. Knowing when to contact emergency services, alternative services for those without transportation. So public education with Zoom, which we use during my presentation, could really be helpful for those that aren't able to transport to these facilities. So this helped to assess factors that influence the health of families in the communities. Also worked on illness prevention strategies and self-care. So with public education, we can talk about these different prevention strategies, how to care for yourself at home, and then follow-up care with physicians and things like that. So this helped to do prioritize evidence-based collaborative practices for clinical prevention, surveillance, outbreak investigation, and case management for individuals and groups. It also hit on analyzing the principles, goals, and determinants of global health, including social, economic, and educational factors. So basically just public education in general, to help the community with different factors, such as the presentation that I did on emergency room equipment, can really help the public to understand their health a little bit better. Some of the personal experience and growth that I did during this project, I expanded on social networks, so I got to meet a lot of different people with, such as the volunteer managers, as well as different volunteers that are out and about in our community. So that really was nice to get to know more people, more knowledgeable about community concerns and needs. So the volunteers have a great opportunity to sit down and really talk with patients and get to know some of their concerns and things while they're in the hospital. So them relaying that to us as nurses really helps us to know how to better our care to them. So I thought that was helpful during this experience. It gave me experience talking to an audience and different technologies such as Zoom. I do have a goal to be a nurse educator in the future. So having an opportunity to talk to a group of individuals and use Zoom as a presentation really helped me with that. It gave me the opportunity to set aside to further explore different equipment that we do have in the ER. A lot of times we're super busy during work and we're not able to sit down and actually look at all the different things. So that was helpful too. Reconnecting to the profession. A lot of times, like we're at work, we're so busy, we forget like why we're there sometimes. So it kind of helps like knowing and reconnecting as being a nurse. Grown professionally with time management, working on this project as well as working full time. It really helped me to kind of work that out as well. I've grown in my ability to reach out and find resources and volunteer opportunities in my community. I found that during COVID it was harder to do this, but there's still opportunities out there for volunteers. And then just further explore different opportunities we have as registered nurses, and the help that we can give to our community outside of our work. Some nursing implications, volunteering works with nursing hand in hand. It gives the satisfaction of helping others, which a lot of us went into nursing to do that. It gives us a sense of purpose and meaning. It broadens our social networks and social interactions between community members and other volunteer staff. I believe social networks is like a big part of our work environment and being successful in our profession. Supporting an important activity in the community is always a great thing, so that helped as well. A couple of studies that I looked at about how volunteering related to nursing. Volunteers at a pediatric oncology camp provided nurses the opportunity to not only engage with their patients, they got to share experiences with these patients, and then they get to view patients as individuals as well, instead of just as people that are sick in the hospital. It makes them really realize like these are people's children and family, and it really helps put that in perspective. The service learning improved students' clinical skills, cultural awareness, and sensitivity, while providing opportunities for community engagement towards community empowerment. That was another thing that this study showed that the service learning helped the nursing students with. In conclusion, volunteering services provided essential opportunities for nurses to engage with the community and expand on personal growth. You can always find areas that you're interested in and help grow in those areas while volunteering. I learned a great deal about the many opportunities available for not only healthcare providers, but also for the general public. Being more engaged and involved with your community helps to better recognize what sources are needed or missing in the area. And then service learning project allowed me to design and create a presentation for volunteer staff that I may not have had the opportunity to do before this. So it got me involved with that community as well as growing as myself as a nurse educator.